Actually, there is dynamic matching complexity values that happen all the time, and there is some kind of optimization where the brain is flexible enough to adapt to the incoming information and keeps distant a specific small distance of matching complexity, altering its internal structures according to the environment changes. But as we know, the environment changes can be abrupt and can be severe, and also the brain capability for adapting to it could be altered by disease or by other reasons. So this matching complexity could not be optimized all the time, and when this matching complexity is de-optimized, meaning that the ability of the brain to adapt to the incoming information is hampered, then we have a de-optimization shift. If the system recovers and the ability to flexibly adapt to the incoming information, then this distance of matching complexity is reduced and we have an optimization shift. So actually dynamically we can look at it as having two types of dynamic processes, the optimization shift and an optimization shift. And I would argue that these shifts of major total global brain dynamics result in emergent properties of sensation of mood. I will argue that the optimization is experienced as depression, and re-optimization or hyper-optimization is experienced as elevated mood or even manic experience. In order to explain mood as an emergent property, I think this is the most problematic part. We have to think about it a little bit philosophically, but the only way I think a physical system can come about with a psychological sensation as mood is using the concept of emergent property. Emergent property is actually meaning that the whole is more than the sum of parts. We know that individual neurons or even receptors cannot have properties of mood, awareness, or personality. But we know that all the neurons together in different organization patterns are numerous enough in order to create an emergent property. It is just like putting your hand in a glass of water and you feel wet. This wetness is not a characteristic of any water molecule, but all the molecules together give you an emergent property or that you feel a wetness. The ability to flexibly adapt to the incoming stimuli and experiences is dependent on the neural resilience. The neural resilience is the ability of the neurons to flexibly generate dendrites and spines and be flexible in connectivity in a way that enables them to adapt to the incoming information. This neural resilience allows for a better global organization in the brain and for the creation of these dynamic global adaptations, which when optimized are experienced as emergent property of good and elevated mood, and when de-optimized or when de-optimization dynamic shifts for the whole brain organization appear, then the emergent property is a sensation of depression. I would argue that depression, anxiety, and other mood changes could be reconceptualized as disorders of neural resilience, or in other words, as neural resilience insufficiency. I would argue that if something hampers the ability of the neurons to adapt and flexibly perform dynamic computations, then we have the optimization shift of matching complexity and depression. And also when the environment is abruptly changing, as happens in stress situations or grief situations, then there is also an increase in the matching complexity because the statistical structure of the environment is largely deviated from the internal representations, and depressed mood is the emergent property. This kind of model can explain the dichotomy between reactive depression caused by environmental stresses and endogenic or internal depression that happens due to metabolic disorders or hormonal disorders, which probably hamper the flexibility and adaptability and the neural resilience of the brain organization. As for connectivity organization of the brain, Here we have a schematic representation of how a neural network may be hierarchically and spatially organized. We can see that the brain needs to balance between segregated specialized processes and integrated processes. On the periphery we have these processes which are segregated from each other, but going up the hierarchy they organize, and at the end we have the letter I, which represents the global organization of the system. The brain is hierarchically organized in such a way that unimodal sensory processes and motor processes are gradually integrated into higher level of multimodal organization, and then into a global transmodal or global organization. This kind of organization can be optimized or balanced as is typical to normal and cognitive processing, but it can also be disrupted. For example, if we have the segregated processes acting statistically independent from each other, then we can get disturbances such as jumping from one concept to another. Each concept is activation of group of neurons which are statistically independent from the others. Or we can also get, for example, regions of sensory, auditory processing of language, for example, that are activated in a segregated way without any relation to the other parts of the brain, and then the person experiences auditory hallucinations. Another imbalance of this structure could be over-integration or over-connectivity. When the whole system is over-connected, then each neuron is not free to act independently from the other neurons, and the flexibility of the whole system is reduced. And over-connectivity can actually cause a freeze or like a crystallization of the dynamic changes of the processing, and the whole brain may be trapped into what we call local minima, or what in neurocomputation is called point attractors, when repeated activation and restricted dynamics is characterizing the brain. If we look at this in a metaphorical way, clinically, we can see that, for example, psychosis or positive symptoms of schizophrenia could be reconceptualized as disorders of connectivity or disconnection syndrome, where different processing are statistically independent, and negative symptoms schizophrenia, where we have perseveration and we have a constricted thought process and poverty of thought and speech, could be reconceptualized as overconnectivity, where the whole system is restricted to few activations and repeating activations and to point attractors.